we have some symptoms that maybe you can look out for in case you're feeling them? A dull ache deep in the shoulder?
Yeah, that's a common presentation, an ache in the shoulder, and usually patients will report that they feel it deep within their shoulder area.
Disturbed sleep? Kind of wakes...
Disturbed sleep, yeah. I mean, that you'll see a lot with rotator cuff tears. You'll see a lot of patients complain, you know, I was feeling a lot less pain during the day. As soon as I went to sleep, I started having pain, and that's another common presentation. So night pain, whenever you have any shoulder type pain and it's occurring mostly at night, that's kind of a red flag that you should go get that evaluated by a professional.
And you kind of touched upon these three here. Unable to lift the arm, you mentioned to us, difficult to reach behind your back, and arm weakness.
So yeah, so those are pretty classic. Unable to lift the arm, like I said, one of the things that we look for with patients is I'll go ahead and try to move their arm under my control, and if they can do that without pain or minimal pain, and then I have them try to lift up their shoulder and they're presenting with a lot of pain, or they can't lift up their shoulder, that's a red flag for me that there's something in the rotator cuff going on or in the tendon going on.
Normally, conservative treatments here, highly unlikely, more prone to surgery because of the tear?
So that's an interesting thing. One of the things that we're lucky with is, you know, the group of physicians that we work with are generally tend to be conservative, in meaning that you come in with a rotator cuff tear, they're going to try the conservative treatment first instead of just going ahead and trying to go into surgery immediately. We've seen a lot of cases where we have the patient come in, the rotator cuff tear is not a full thickness tear, and it could be on the smaller side, and they go ahead and come in to rehab, and we go through a stretching program and a strengthening program along with all the other techniques that we use, and they're able to avoid surgery. So those are the type of things that we kind of can help with, obviously, in trying to avoid surgery. Obviously, there is cases where physical therapy fails or the conservative type treatment fails, and then those eventually have to undergo surgery to actually repair the structural damage that is there in the shoulder.